Yes, it is. Welcome back. Thursday, July 15th, 2021. Couple things on my mind right off the top. Welcoming your calls and input on any of it. Our number 602-508-0960. Here we go again. Jen Psaki, White House press secretary, said today there's about 12 people who are producing 65% of anti-vaccine misinformation on social media platforms. All of them remain active on Facebook, despite some being banned on other platforms, including ones that Facebook owns. She then goes on to say Facebook needs to do a better job of flagging these problematic posts. Well, that's interesting. That's interesting because you now have the press secretary of the United States asking a private industry, and we have been told how many times that Facebook is private and can't thus be regulated. We now have the federal government, the president's very spokesperson, telling a private company it should engage in further censorship. Now, this brings several problems. First of all, I'm not sure what kind of vaccine misinformation she's talking about. If someone is suggesting you don't, or saying or arguing, you don't get a vaccine, then the question has to become, why? What are they basing it on? Are they basing it on a religious exemption? Well, that's always abided. That should have always applied. Are they basing it on them being afraid of the consequences or the reactions to a vaccine? Many people know a lot of people that have had bad reactions to the vaccine. In fact, the FDA website itself warns that side effects of the vaccines can include fever, nausea, coughing, and all of the very symptoms of COVID. And if someone is perhaps somehow not at risk of a serious COVID infection, if they are, I don't know, let's just say a marathon runner or a half marathon runner, a 35-year-old 10K runner, if you're my producer who eats nothing but vegetables and fish and sprints on a daily basis and has, 8% body fat, maybe you and hasn't gotten COVID in a year and a half. Maybe he wants to say, I haven't gotten the symptoms of COVID. Why would I want to risk injecting myself 2 times, probably, where the FDA says the consequences could be fever and coughing and nausea, the like, headaches. Is that an irrational decision? It's not if he's responsible for his own health. It's not if he's responsible for his own health decisions and what medicines he wants to and doesn't want to take. It's not if he's allowed to decide for himself that maybe he doesn't want to keep eating vegetables and fish and he's going to eat at McDonald's in the morning and Burger King in the afternoon and cook himself a chicken fried steak for the next 5 nights. He has that right as not just an American, but as a human being. He has all of those rights. Is that spreading misinformation if he says, here's why I'm not getting vaccinated, and perhaps to my fellow friends in similar circumstances, you don't want to be vaccinated? See, here's the problem. That's just only one objection to the vaccine that I believe to be a legitimate one, if that's a view you have. There are other concerns. If you are a young person, if you are under the age of 15, if you are under the age of 9, then there are, of course, the adverse reaction databases. there are a whole number of reasons you may not want to get a vaccine. Is the argument for a vaccine stronger than the argument against it? You have to make that decision as an individual capable of determining how many glasses of water you decide to drink today and how many showers you decide to take this week. If you want my own view, I'll tell it to you. My own view is that the argument for vaccination is about 60% stronger than the argument against it, which is about, to me, a 40% argument. I can be persuaded, and I'm not fixed at that, just based on what I've read. But I have no interest, compunction, or desire to see fellow Americans who they don't know asking strangers in stores, as I have witnessed time and again, are you vaccinated? I have no interest in seeing the federal government mandate vaccinations. I don't think they have the constitutional authority to do so, nor do I think states should or localities engage in that, and I would join any fight against it that I could, though I do worry it would be, under current precedent, constitutional. And I don't want to see private corporations, though they have that right, so far as I can tell, to mandate vaccinations. I don't want to see it. I don't want it to happen. I will fight it. Though I think as an individual choice, it's a good thing to do. It just shouldn't be mandatory. That having been said, when Jen Psaki wants to shut down the debate and Facebook shows all the interest in doing so, it comes with a legacy. This doesn't come out of nowhere. It comes with a legacy of the other things the left has tried to shut us up on, particularly with regard to COVID, where it turned out we were more right and they were more wrong, though they controlled the microphone, rather they controlled the megaphone, and they controlled the lights, and they controlled the cameras, and they controlled the message. I give you the virology lab leak thesis as just simply one possible piece of evidence that they have been more wrong than right when they try and censor us. How about the social destruction and disruption to our children's lives? We have been more right than wrong. What about the uptick in things like substance abuse that we would see happening? We were more right and they were wrong. YouTube and Google banned discussions of this. Why do they say this? I was one of them. I engaged in an experiment. I was told the first time I was banned by YouTube's folks that we can only quote government sources when we speak about COVID. That's what they told us. So I tried an experiment. I got on air and I read verbatim, the Assistant Secretary of Health and Human Services for Mental Health on shutdowns, lockdowns, and children's mental health. Is that a government source? Assistant Secretary, Senate approved, HHS, Health and Human Services? Not only Senate approved, PhD in epidemiology, MD in psychiatry, not psychology, which you can't get an MD in, psychiatry, a double doctor. Quoted her verbatim and said up front, I shall now quote Dr. Eleanor McCants-Katz, Assistant Secretary of Health and Human Services. Guess what YouTube did? They banned it. She's right. By the way, now we see 93,000 substance abuse drug overdoses. 93,000. That number has never been higher. So they try and censor this stuff. We've turned out to be more right than they have. I could talk about masks. I can talk about transmission. I could talk about any number of things, vulnerable populations. When they shut us down, be very, very, very concerned. Not only are they shutting down free speech, they more likely than not are shutting down truth, because that is their legacy. That is the pedigree they come to us with when they talk about banning misinformation when it comes to COVID. They are not in a position to lecture us on misinformation when it comes to COVID. Anthony Fauci said, don't wear masks. They can't help. In fact, can do more harm than good. Then it was mask. Then it was double mask. Anthony Fauci said we could not possibly have a vaccine within a year. We did. On and on. He lied to us and said he lied to us about the numbers for herd immunity because he didn't think we were prepared for it. That's the first step, folks, when you're not prepared to hear the truth because the government tells you so on your own health. On your own health, know that they're vested in lying to you.